people are joining, we will be welcoming by name. So, yeah, before I start, I hope you all have got a link and your joining journey would be smoother. So, welcome everyone. This is not a generic AI awareness session. Let me make it very clear. It's a basically skill first program. And just to set the expectation, I would say by the end of this session, you will be having a working prompt framework and a tool comparison and your first AI output in healthcare context. So we will be covering across the sectors, like we are majorly bucketing in our six prominent sectors, which includes hospital, diagnostics, pharma, medtech, insurance, and public health, of course. So wherever you end up, working or maybe working now and today as well, you will be having this particular session with the skill set which you can directly apply. So let's get started.
Chandrakant, would you like to present or shall I continue?
Yeah, please continue. Go to the next slide.
Yes.
So just to give you a glimpse of agenda, we are not having a theoretical discussion over here. It will be all demonstration, and you will be seeing on your screen how we are using tools and techniques, especially the framework part, which we will be discussing over here. And it's basically the healthcare practitioners or maybe healthcare professional, you can call it, operating system. So this basically is what we are going to discuss. So before starting, I would like to understand from all the participants who have joined this session, which of these do you, if I may ask all of you, so we all be spending time on Excel's, PPT, emails, reports. So if you can just put in a chat window, like which of the tools you use on daily basis, so we could understand that how many people are spending more time on the Excels, PPT, email, and reports. So meanwhile, everybody is putting on chat window. I have started getting the response. Uh, let's go to the next slide. So yeah, we as most of you know that we are hosting the session. So just to give you a background of me and my colleague Nirmal. So Nirmal comes from a very wide experience, mostly 12 plus years experience in consulting, hospitals, and he is also an engineer and done masters in hospital administration from Tata Institute. And I come from a mostly from a hospital background, specifically from strategy and operations. And I have spent 8 plus years in industry, and we both have decided to deliver this session because we are continuously using these tools, and we had thought of why not to spread this particular framework what we are using, and let's help our professionals to be more productive in their day-to-day work. Let's go to the next slide, please. So before I start, I would say that you all know that how hospitals and entire healthcare industry is going to get impacted with the AI, right? So just to understand, I'll be putting out a poll. Meanwhile, I'll be talking. So I would request all of the participants to kindly respond to the poll. So as we all know that India healthcare ecosystem is the one of the fastest moving in the world right now. As well as if you see the globally that a lot of new economies are, pacing up and speeding up their healthcare delivery. Specifically in terms of Indian healthcare, Ayushman Bharat Digital Mission is pushing digital first workflows across public and private hospitals. NABH accreditation is driving demand for the quality and documentation, teams who can work faster. And if you look at the consulting and medtech jobs description in the last 12 months, I am sure all of you have noticed that somewhere they are asking for the some sort of AI literacy in each candidate. So if I may share my personal experience, yesterday only I've got a call from one of the, a big hospital chain in India. And during the discussion, they have kind of checked with me whether I know using AI with the tools like Excel, PPT, and as we all are like still learning. So they were not expecting the very high level of literacy, but at least you should know what sort of work can be reduced, and manual intervention can be reduced and time can be saved using those tools. So I think uh, poll is live, and if you can just put out, let me just put out the poll. I'll be just stopping here for 10 seconds if you can just see the poll and respond accordingly. Yeah, we are getting good responses. So we have got a lot of people from hospital administration, public health, consulting also we have got a lot of people. Majority of them is hospital administration. Yeah, so good number of people from hospital administration, public health and consulting. There are few from the insurance and pharma as well. So in the next slide, we will, Tirmal, can we go to the next slide, please? Yeah. So in this slide, I'll be just pausing for a moment and I want all of you to just, glance through the data and you will be understanding why we are here today. So as you can say that we have just put a Indian digital health market from the Indian context, and you can imagine the quantum of the market size in globally. And since the markets are opening up, and healthcare market is not very country specific or the continent specific as of now, and 30% of administrative tasks in healthcare could be automated by 2030. And this is not from any cooked data. This is from coming from the very well known research. And you can see the top 10 skills going to be the AI fluency is one of those skills which will be useful in future. So that's why we are here. And I understand that all of us will be using AI in some way or other way. Maybe you might be writing an email through ChatGPT. You might be generating photos through ChatGPT or Claude. But this particular skill requires little more understanding and deepen your thoughts. So let's understand what will be the impact of these AI tool in your life. So we have another poll which we will see, and I'm just going to launch that poll. Let's see how many people feel that what is the impact of AI in their life. And I'm going to show the result as well. It'll be good insight for all of you. Yeah, so good amount of people are saying that the impact is slightly, maybe 10 to 20% will be the productivity drop. And there are good amount of, I mean, it's tie, like people are saying slightly, the number of people saying moderately are equally in the numbers. And there are very less people who are saying the significant. Sorry, I have to mute a few people because there was a noise. So let me just show it to you. I will be sharing this result with all of you. Now,
Chandrakant, it is already there on the screen.
it is already there in the screen. Good. Now you can see that, out of so many participants, I think almost 20 people have responded, and everybody feels that, there will be an impact of AI disappearing tomorrow. And that is where, AI becomes a significant use case for us, especially from the healthcare perspective, because we all are in the field. where the productivity becomes our top priority, because we are not the people who works in a manufacturing or somewhere where we don't have to deal with the do and die situation. But here we are really dealing with the patients' lives and how we can improve the clinical outcome. So that takes me to the next point. Let me just stop sharing it. Next point, that whatever work you are doing currently, I think out of these four quadrant, you will be falling in one or two, right? So if I talk about the repetitive task like MIS reporting, dashboards, billing code lookups, rosters, discharge summaries, all of this is happening in your hospitals. Whereas if I talk about the analytical part, where you do some variance, cost analysis, root cause analysis, KPI performance review, all of this is taking the whole lot of time of your productivity. And when you do this, you also somewhere feel that every time I am doing the same thing and it is taking hell lot of time, why can't we automate it? No doubt that healthcare has taken further steps to automate using EMR, HMIS, but it does not help you at that level which we are talking here, because we are talking about the individual productivity. Being a manager, being a CEO, being a anyone who is sitting at the upper or middle management, everybody wants to be a more productive and thinking towards the growth of the organization, how we can drive the profitability. So I think we will be mostly touching upon all these quadrant through the hands-on demonstration over here. Let me go to the next slide. And so we understood why we are here, right? Now the next question comes to how. I think everybody over here who has joins this particular discussion, uh, can you just tell me that what are the steps you have taken in terms of increasing your productivity? If you can just type in the chat window, and in the next part, Nirmal will take you through the actual demonstration of what we have committed over here. So just type in chat window, what are the steps you have taken? Some people are saying they have started using AI. Some people are saying they have, started Google Gemini. People are saying they have done some Claude automation. Very good, very good. I think somewhere everybody has taken some steps. Now it's the time to understand how those steps can be optimized using proper tools and the frameworks. So Nirmal, over to you. Please demonstrate us.
Thanks, Chandrakant, for the background and setting the context very clearly. So, guys, as Chandrakant has mentioned, we are not here for another AI course or kind of GAN kind of thing. This is purely going to be very practical demonstration thing, because we also know the interest of the people. So, first of all, before going to the case, I would like to thanks everyone who has joined. So far, there are people who have joined from Middle East, Asia, who is well behind the time. I think there must be 7 a.m. or so. So thanks a lot. So the point what we are trying to make is, we are not going to tell you how to use Copilot, how to use ChatGPT, etc. I think some way, to some extent, you guys have been using it. If not in a very pro manner, but at the initial level, you are using it to improve your utility. So in the next three demonstration, we'll start with the first demonstration. So over the period of three demonstration, we will be showing how to think it, and it is not as we mentioned, it is not only using the AI in silos, but how to use it following a structured workflow. That's what the deal breaker is. So all of us are no, means all of us generally create PPT, deck, etc. Be it public health professional, hospital professional. Okay, so we know what to be done, where to start, and how we have been doing the work so far. Okay, so maybe some part of that get automated, some part of that we are doing it from the scratch. So guys, I'll take a pause here to hear back from you. I mean, to understand from you. Just put in the chat window, when we are hearing something to create a PPT or deck, what is the majority of your time consuming in this process, whether it is research work, analysis work, storyboarding work, or PPT final formatting and creation work? I'll take 20-second pause here to see what people are responding in the chat window. Yeah, data analysis. Dr. Priyanka is saying, Dr. Ashish, analysis PPT, approximate 1 hour analysis and PPT. Okay, guys, great. So there is not much difference. Okay, and I hope all of us are agreeing that these are the four key steps involved in creating our deck. It is not that key data available here and we are just starting putting the table, graph, etc. Just to create the deck, etc. So let's start with the real-time context. So it will be more or less different for different individual, maybe for public health or hospital or consulting, etc. But the thing is, all of us, we might have experienced similar kind of thing. At in the middle of the day, we are getting a call from the boss or the CEO. So, hi, Nirmal, tomorrow we are going to have a board meeting. Okay, so why don't you create an evidence-backed, compelling proposal on AI-enabled diabetic eye screening for a corporate client? So the context is that I'm working as an executive, senior executive, or director or manager in the firm, and I am asked to create a pitch deck, okay, for a corporate potential client. And the context is we are dealing with some sort of AI solution who are for the screening purpose. So let's see, guys, how it goes. So this is the background, and the left part is the situation. As I mentioned, the steps involved and the different context for different people. So, guys, tentatively, how much time you guys will take? It will take to create that deck from the. These are the steps involved: research, secondary research, then data analysis, then deck preparation, putting some good visual, storyboarding, and then final presentation to the CEO. Just put your views on the chat box. Let's see. Come on, guys. I'm waiting for the responses before we move on. Avik Sharma is saying 1 hour. Okay, no problem. 1 to 1.5 hour. Great, great. 2 hours. Great. So, guys, let me give that actual context. Definitely, to create the deck, definitely it generally takes 1 to 2 hours. But the quantum of work involved here is not only to create the deck. As I mentioned, this is this is the workflow, typical manual workflow. Secondary research from the secondary means from the web, then market and industry analysis, then evidence preparation, then storyboarding, and then the last two things. So we are talking about many means multi-step process. So generally it takes at least 2 to 3 days from the end to end, from research to give the final output. But let's see how we can able to create that deck within 10 to 20 minutes. So in the interest of time, what we will do, we will not do each and everything from the secondary research to deck preparation here. That will be saved for the upcoming cohort in the following weeks. But what we will do, in the interest of time, we will show the how we can able to create the PowerPoint presentation within 10 minutes of time. Okay. So before that, I'll just show you. I think it is a compelling and it is a kind of final deliverable. So it is with a good narrative. So let's see how it works. Okay. So I will just switch the window. Right, just a sec. Okay. So for this, for the interest of all, what we'll do, I'll not use only one AI to create the deck. Rather, I'll give the same prompt to Claude and to Gemini to create the PPT. Okay, so what we will do, there are two things. One, will be entering the prompt, a detailed prompt, not the research data. From the research data, we fine tune the prompt, and then we have a structured prompt, like we will be showing how it works, the entire architecture. But there is a role, and there is a detailed command what to be created, and what are the data we need to incorporate. So let's copy this, and then in a new chart window, new chart, I just pasted it, and I'll just type read this and read this, find the attachment, and create an executive deck in 16:9 aspect ratio, and share the PPTX. Okay, so this is the prompt we have given, and there are some, as I mentioned you, we are not starting from the beginning. There are some file I would like to enclose here. So those are the files we derive from the you know from the research. Okay, for the usage. So I pasted all these five files, and then I put the hit button. Similarly, we'll go to the Gemini. I entered the uploaded the files, and then I'll just copy and paste the prompt here. Guys, just have a look at it. When you are creating the deck, giving the command using the deck, means using Gemini, you have to click on canvas, because this is the option Gemini understand that you are giving a prompt to create an editable deck. Okay, so for the interest of the beautification and good quality report, I just put pro, and then I just put the hit button. So let's see how much time it will take. So guys, you can see the real time communication which is happening. So the thing is, I am not means it is not, I have not given the random prompt. Okay, so I'll just say notify when it is done. So we have given a structured prompt. See what kind of activity is happening in the background. It is analyzing the prompt, then it is giving the I have successfully coded. Okay, so it is still working on it. So it is analyzing the input what we have given, the long input, and then thinking like a CEO or kind of senior executive to understand what are the inputs given, and to analyze what is the expected output is. Okay, so now it is creating unable to push. Okay, we'll come back because both the models are working here, so it may take some time. Okay, so I'll just switch to the presentation. Okay, guys. So by the time it is processing, while I would like to emphasize here, we are only focusing on the last part. So we have the input from research, analysis, storytelling, and then the story we just put the command for to create the presentation, and then after that the final step will happen, the executive decision. Okay. So let's see, by the time it will the output will come, let's see the thinking framework. Okay, so guys, as I have mentioned, it is not the output of only one AI random prompt and giving output in one AI. Definitely you'll get something, but not in at the time, means not at the quality of the expected output. So first step is the perplexity. So this is the research analyst. It will pull all the kind of data, required data from the secondary, then Claude and the ChatGPT. either of them can be used to create the storyline, narrative, and story bible. Then finally, for the creation of the deck, we generally use Claude or Gemini. In this case, we are using both, and this is the input we have given prompt to give the output. And finally, you will have to do some kind of fine tuning on the formatting, on the kind of animation, or in the on the putting the logo, branding, etc. So this is the thinking flow, how it works. So let's see the final output. I think by the time it might have come. No, it is taking some more time. Boom. Now it has given in some HTML format. I'll just give another prompt, share the PPTX here. Okay. Sometimes it gives in one output format, sometimes it takes time. Okay.
So I think Nirmal, you can just show them the whatever you had created previously, and meanwhile it is
Yeah,
getting created. We'll just run through
yeah,
it.
I'm just trying. I thought it could have created in the real time,
Yeah,
but
but in
yeah.
interest of time, I think we should do that. Yeah.
Yeah, so guys, this is the deliverable, expected deliverable. Honestly, these kind, as I mentioned you, I'll just blow up the slide. I'll not get into much more details inside what is written in the slide, but in order to give a look and feel of the slide, it is telling the context why now of the background, what is being asked, why the eye screening is important, and why what is the current trend. So as you can see, this is a cited research. 100 means there is 10 crore diabetic patient by 2045. It will increase to 12 crore in India, etc. and etc. And these are cited research. Okay, this is ICMR data. Then this is two is national guideline, etc. and etc. And then next slide, it is telling about the problem, the scale and cost of inaction. If you are not taking any action, then what will happen? Then the solution, what we are proposing, and then finally, what is the comprehensive benefit of that particular AI, proposed AI. So benefits employee on employee, family, employer, and ESR. And this is how we are going to get engaged with the client. So I think it is a good kind of short presentation for the initial, as per the ask of the CEO or the boss. So let's see. Yes, boom. Yeah. So
Yeah, it got
Claude
created.
had given the output. So let me download it. So guys, you have to just download. Okay. And you have to open the file. Okay, guys, as I was showing to you, see, it is just exactly the same output. Okay. With some kind of different format, etc. But yeah, why now? This is cited research, and this is the trend. Then the problem, the same thing, the funnel, how many people are at the risk zone, and what is the risk involved. Okay, and then what is the solution we are proposing? Then what are the benefits, and what are the kind of partnership model we can engage with. So guys, I believe you have seen how it work in a real time. Sorry, I took a little bit more time here. So post that, as I mentioned previously, in order to arrive here, you have to do a small kind of fine tuning on your deck. So hence it the final step is here, PowerPoint manual editing. So the one point I would like to make here, it is not about replacing you. AI is not replacing you. It is just about you are creating a kind of architecture to think like a multiple. You might have heard about agentic AI. So different kind of AI is doing different kind of work at their best level, and you know how to get the best use of the AI. So so far, I'll take a pause here, and over to you, Chandrakant, for the next use case.
Yeah, thank you, Nimal. Can you give me the control?
Yeah, I'm stop sharing.
Yeah. So let me just share my screen.
There is a question in the chat box. You may please answer in the meanwhile.
Yeah, Nirmal, can you take that
Yeah,
question? I'll
sure.
just set it up. Yeah, so just to interest, taking care of all of us interest, I think we should be taking the Q&A at the last, because we just want to run through so that we cover all the parts which we have decided. And as Nirmal rightly said, that it is not about what prompt you are writing and what exactly is the tool. It is all about the framework which you have developed. So it's not basically what framework I am using and the same has to be used by you. You can use it comfortably as per your requirement, as per your uh, you know uh, use case. So in the second case, where we will be mostly, I think my screen is visible to you. Yeah,
Yeah,
in the
please go ahead.
second case, we would be discussing how we can simply create a Gantt chart for a project which has been decided in a hospital. So before getting into it, I'll just show you the output. So this right side may you can see the output of the Gantt chart. And what do you think? How much time it should take for you to create this Gantt chart if I have given only emails, minutes of the meeting, and some of the WhatsApp chat, which has which is reflecting somebody saying ki for maybe for commissioning, this much time would be required. In email, CEO is saying, no, I want this particular project to be closed. And minutes of the meeting, may there are multiple stakeholders which has committed different timeline. So you have a entire communication dump in one document. So if I may ask, you can type in chat window like how much time it would take you to extract the data and create this Gantt chart manually, or maybe some sort of tools you would be using, how much time it should take for you. Anybody? And for those people who don't understand Gantt chart, let me tell you, Gantt chart is a simple representation of any project's timeline and the activity duration, which is plotted in the left side. So in the y-axis, there are activities, as you can see here. There are activities, and on the right side x-axis, you can see that how much time it will take for the particular activity. So this is as simple as that. Your calendar for completing the entire activities, and there are stakeholders also which are involved in this particular project. So if you can just type in chat window how much time it will take. Meanwhile, I'll just share my screen and show it to you how I did it. So I have this particular file. I'll so you all can see this is the entire communication dump which I have put in a Word file. So I have just taken a dummy template for all of you to demonstrate. So in one email, the CEO is saying, board approved a new cancer center with the LINAC 12-bed chemotherapy daycare bunker, MEP interiors and support area. Target completion is 12 months. So you can see that CEO is saying we have only 12 months to complete the entire facility, and which is cancer facility, which has LINAC and 12-bed chemotherapy. And in another email, if it has come from the project manager is saying, bunker must be complete and cured 6 weeks before delivery. So project manager always keeping the buffer for the project delivery. So these sort of communication you have. So what we will be doing is we will be simply going to ChatGPT, and always for any new project, I think I would be recommending use new chat window so it gets a better context. I will be just adding this particular document from my desktop. So this particular document, Cancer Center project, I am uploading here. Okay, so it is showing file in use. Let me close this first. Now it will be added here. So meanwhile, it is getting added. let me put a prompt which I have already framed for this particular, and it's a small prompt. So I have used particular prompt using my own framework, which I feel works for me, and I am pasting it here. Right. So in this prompt, I had asked the ChatGPT to do me a favor in terms of creating this, referring this particular document and create a table of all the activities along with the duration and start and end date, plus what are the stakeholder involved in each activity. So let's see what it does. So it's pretty fast. Now you can see that, I have uploaded a document and it has created the entire activity table. So for cross-checking, I'll be just opening the document which I have uploaded. So this document I have uploaded. And now you can see that I have the output in my chat GPT. Oh, sorry. I think I've closed the app itself in terms of closing it. Maybe. So it's there in my library. I'll be just. So yeah. So this table has been created. Now you need a little bit of Excel skill to, convert this particular table into Gantt chart. You can do it directly through ChatGPT as well, but that would need you to have a, paid version or maybe pro version. I am just showing it to you from the perspective that you don't have any paid version and you want to do it by yourself. So I am just copy pasting here the entire. See, now this particular table has the activity, duration, start date, finish date, and what all the what all are like, stakeholder for the activity. So what I'll do is, because duration, I think it's in weeks and days. So that's not a big issue. We will just create another column for maybe we want to understand from the days perspective how much days are required. We don't want week. So we'll just do this duration. I will remove this particular column. I don't need it now. See, now you just need a basic, Excel skill to create a bar chart. I think you all might have done it in some way or other way. I'll be taking the stacked bar. So now one stacked bar is created. I'm just running fast. If anybody doesn't understand anything, please type in chat window. We'll be responding to you on towards the end of the session. So as you can see that left side, you have all the activities. On the right side, I have just taken a starting date. So Excel understand everything in terms of numbers. So as per his understanding, he has created a bar chart. Now what I'll do is I'll add here the duration, right? So I'll take this duration. I'll just add this duration here and I'll put OK. Okay, sorry. I think it has got created, but somehow was not reflecting. Let me do it again. Probably it needs a bigger area now. So duration has been added. Now what we will do is, again, it's some sort of representation is not good. So I have put this number. Now, if you see that my starting activity was project kickoff. So what I'll do is I'll just make the entire axis reverse. But still it doesn't feel that it is starting from the zero here. So what we'll do is we'll just change the axis maximums and minimums. So for that, I think you can simply convert, okay, this in number, and we'll put the maximum and minimum number over here. Maybe I'll go to the format, and I hope all of you are following me because I'm doing it a little faster so that we save time. If any doubt, please type in chat window. We will be responding, and I will put maxima as a finish date. So minimum would be my starting date and maximum would be my finish date. So I'll have this particular Gantt chart plotted over here. So I think if somebody do it by itself, I think it is not more than 5 to 7 minutes, which should take. I'll just add probably the duration. So now you know that which activity will be taking what time. So I'm starting. Let me read out few activities like final design freezing would take 2 days. Site mobilization would take 6 days. So this itself you can simply copy paste and drop in on any deck, or maybe you want to discuss it with your team. You have the clear representation of the entire project. So this is how you can exactly use the chat GPT or any which ways. I have not used any pro version for your information. So this is as free as what you have. It's just that you should know that the basic skills of AI. So I'm just stop sharing this particular file and going back to the deck, right? So this table we have created, I have created in front of you using these, random communication. Dump in a Word file. It might be Excel file for you. You can use the same. Let's go to the next thing. Now, what I feel is, whatever I've showed you, I have just put a flow of it. The input source, you can say that input source could be anything. Then I have consolidated the entire communication in a single document, and then I have put a command prompt for the chat GPT, and that chat GPT has given me an outcome, and then I have put it in the Excel file. It is as simple as that. Now, the next thing I want all of you to try at your level, it is much easier than what I did now. Uh, so let me show you again. My window is here. What if there is a project data like this? Let me put it for you. So this is the case. For example, consider a hospital chain which has hospitals in Mumbai, Bangalore, Nagpur, Ahmedabad, Nasik, Gurugram, Delhi, verticals, Hyderabad, Kolkata, and so on and so forth, right? And they have this, and by the way, this is like the actual seat which most of the hospital manages, right? The project department especially manages it. They have this seat which says it has some initial budget, then the budget has been revised. There is some variance on the budget, and what was the starting date, what was the proposing date approved by the board, and what is the delay which is running. And these are the remarks given by the project manager why something is delayed and where they are standing currently. Now, if somebody asks, maybe CEO of the company comes to a project manager and says that, you show me how many of them are like high risk, high impact project, how many of them are low risk, low impact project, or maybe high risk and low impact project. Now, by reading each of the text, I think it would take another 2 3 hours for a project manager to understand which project needs to be put where. Now, what I'll do is I'll simply go to ChatGPT, and as always, I will use always the new window. What I'll do is I'll just close this so that I can upload the file. I will add a file here which has a random remarks column, and so this particular project file I have uploaded, and I have a prompt with me which I did some formatting, used framework, and created this prompt. I am just posting here. Now I had asked ChatGPT to read this document, understand it properly, and let me know which projects is more important for me, right? So let's see what happens. Now he's trying to understand the document, because any document whichever you will upload, it will take some time to understand the document. shouldn't be taking this much time.
Chandrakant, by the time it generates, you can go back to the
Yeah,
slide and explain the framework. Yeah.
sure, sure. So, we'll come back to the outcome, what outcome has come. So in that particular activity, what I did is I have taken this particular file and I had given a ChatGPT a command to analyze this file and understand which project is more important for me. So our end outcome would be this particular metric where we wanted to understand which project is. So in the left, in the y-axis, you have impact. In the x-axis, you have risk, and you can easily bifurcate which all project are, placing where. So ChatGPT would be giving you this sort of table, and for this matrix, you have to a little bit use your, PPT skills, or maybe if you have a pro version, he can directly, create this particular slide. Let me just go back if it is done. Yeah. So this is done. Now you can see that, it has completely given me what classification comes under which projects. Like he said, Nagpur one is high risk and high impact project. And what was the reasoning? High value expansion with delays and execution dependencies. So he has basically bifurcated it in terms of the budget. If the budget is high, then it has to be taken on the particular priority. And if you see this Gurugram renovation project, it said that high risk and low impact project. Risk identified, but renovation work has relatively limited downstream strategic impact compared with the new facility. And apart from this entire, comprehensive table, it has given you a 2 by 2 metric over here. You can see that, there is there is high risk and high impact projects. So he has bifurcated. These are the projects like Mumbai New Tower, Bangalore Tower, Nagpur New Tower. All of these are like high risk projects. And there is like low risk, low impact, high risk project also, which are Gurugram renovation, as we have seen in this particular table. So, guys, what I'm trying to say is that, you might be using ChatGPT or any of the tools, but I think you need a framework. You need a clear thought process. What is the outcome? And we all use all these tools, but I think randomly we are using, and that we had realized few days back and tried creating some framework so that, outcomes are quality one, and we are not, wasting most of the time fine tuning our outcomes. So I think we had completed our entire project management thing. I might have taken a little more time. Nirmal, it's over to you. You can just run through us the next slides. I'm stop sharing.
Yeah. Thanks, Chandrakant. Let me share my screen. Yeah. So, guys, you might have seen we are not asking random chat. Rather, we are asking the right question or giving the appropriate thinking structure to the chat GPT or whichever AI model you are using to give the desired output. It may give the desired output in one step. You may need the iteration to do some following steps. Okay, so let's see the most required thing, the use case three, reporting dashboard. So across the work vertical, I mean, be it you are a supply chain manager in a hospital, or finance manager, or MIS guy, or billing manager. So each and everyone has to create some sort of report or dashboard for the BRM business review meeting or monthly review meeting, etc. And this is the similar kind of context in the public health as well. Okay, so I'll take a pause here to understand the perspective. If you are asked to create a dashboard for the CEO review meeting, maybe monthly CEO review meeting, how much time you guys take from the scratch, from the data collection from HIS till the final presentation, so to the CEO? Could you just put your thought in the chat window? Quickly, we will see what is the responses. Guys, I believe all of you might have created some way or other way, may it Power BI dashboard or PPT or Excel sheet. Happy to hear back your thoughts. How much time you are generally taking to create?
Yeah, people are responding. They are saying 30 minutes, 2 days, and so many
Okay.
responses. Few people are saying 3 days. Yeah, I think Nirmal, in interest of time, we should run through.
Yeah, yeah, sure. So, guys, let me take 1 minute here to showcase what is the thought process. From the raw data to CEO decision ready dashboard, we can able to create in less than 1 hour. Again, it depends upon the kind of speed, kind of data, means structured data, etc. But more or less, it can be done. Generally, it takes 1 to 2 days, as you rightly some of them have mentioned. Yeah, in some cases it can get done previously also, means say 1 to 2 hours. But let's see how we can able to create in less than 1 hour. So as I mentioned, we will be focusing only on the last part. I means the typical in order to avoid the manual work. So let me show my screen. So far, we will be focusing on the hospital dashboard. So there are, you might have familiar with all these kind of sheet. So we have three sheets. One is the hospital operations uh, data from April to June. Then second one is the finance supply chain data. Third one is the patient experience data, the marketing or patient feedback data. Okay. So let me show you quickly what are the fields. So this is the executive summary. What is the revenue target, EBITDA target, then occupancy, LOS, etc. And against what are the variants. Then department performance across the department, revenue, budget, OPD footfall, admission, occupancy, average length of stay, then patient satisfactory remarks, then status. Then doctor performance. Okay, so doctor code, department, and then procedure made, etc. Okay, then we'll go to the next tab. These are the daily operations, means OPD, IPD, admission, discharge, etc. Then similarly, from the Oracle or the ERP, we generally download the financial finance summary month on month basis. Okay, and the payer mix. What is the cash revenue, insurance revenue, corporate expenses, etc. And then the purchase register. So couple of my ex-colleagues are also joined the workshop. So the thing is, we generally extract in this manner, and on a daily basis, the supply chain and the finance guy has to go through all this kind of thing. Who is the vendor? What is the department? Category, item supplied, quantity, shortfall, etc. And the inventory registered item wise. So, for example, paracetamol, where it is located, what is the opening stock, receipt, consumption, closing stock, and inventory days. So each and every item are cost. Okay. Then finally, the patient experience. So guys, what we'll do, I'll come back to this sheet later in the interest of time. What I'll do, we have the data and we have a prompt. Okay. So this is a prompt, structured prompt, 2 3 pager one. What we'll do, we'll copy this prompt, and the workflow is something like this. We'll go to Perplexity or Claude or anything you have the access to. Okay. So then you copy pasted the prompt, and then you have to upload, you have to drag and drop here. Okay. And it is a structured prompt, as I mentioned, with a role based one. The three files got uploaded. Then you have to put the create button. Okay. So by the time it is reading, I'll just demonstrate what are the steps involved inside the thinking framework. Again and again we are mentioning. So guys, before giving the output will look something like this. And I believe most of your uh, means the CEO or your bosses will like it. Okay. Then let's see how it happened. The point is not what is the output. The point is how you can create your own use case to get similar kind of output. So there are 5 steps. Step one, all of us know, data collection. It will give some output like department wise data, the Excel sheet I showed. Then step two is we uploaded, and as you guys might have seen, we just copy pasted some manually typed prompt and
Nirmal,
uploaded
just sorry to interrupt you in between. So we are like 12 p.m. is now. So we will be just stretching it for 10 more minutes. I request all of you to be here. We have a surprise for all of you. And Nirmal, we have to run through so that we will be able to complete. Yeah, please go ahead.
Sure, sure. Step two, what we have done. Step three and step four, the entire thinking mechanism, how AI will perform. All the KPI calculation, trend analysis, etc., will be done in the backend inside the thinking framework of that particular AI. And step four is the output. So far, I'll show only one dashboard, CEO dashboard, and the remaining COO, CFO, and supply chain dashboard, persona based, we will demonstrate in the upcoming cohort. Okay, finally, we will get the final output. So let's see how far it has gone. Still it is okay. So as guys, as I mentioned, you see the thinking pattern, how it is thinking. Okay, so it will take some time. It is not a simple prompt, however, and you have uploaded 3 months data, which is significant amount of data for any kind of prompt. So by the time it is giving the output, I'll just go to the next case 1.1. Uh, so similar kind of dashboard also in day in and day out, the public health professional need to create some way or other way. So this is a specific dashboard for Maharashtra NCD program. So there are timeline on the top and left hand side. It is a different kind of trend and KPIs are there, and what is the screening funnel district wise, what is the heat map, etc. So I think guys, these are doable thing. As I mentioned, it you could have means I could have taken more time to explain each one of you each component, but in the interest of time, let's skip it. So you can able to make it within half an hour or less amount of time. Okay. So let's see again defining chart structure. Okay, fine, guys. So this is what I would we have been emphasizing from the last 1 hour. So far, we have emphasized on the time component, time engine. So this is called HPOS, Healthcare Productivity Operating System. So it is not a kind of sophisticated means theoretical thing. Basis our experience, we have created this acronym. So there are four components: time, decision, capacity, and trust. So far, we have demonstrated how to optimize your time by using a structured framework. In the upcoming session, we will demonstrate decision, capacity, and trust, how to accelerate them, how to means improve them. Okay. So again, I would like to emphasize, it is not that over the period of 3 cases, it is not that a single prompt is making the case. It is just how you are using those using those AI by giving the appropriate prompt to the appropriate LLM to give the desired result. Okay.
Thank you,
So
Nirmal, for
next slide.
explaining everything. I think we need to little cut short. So sorry, I'm in between interrupting you. So
No
guys,
problem. This is the last slide.
this particular session comes to end, and I think we were able to justify with your time, your precious time you have given. It is we are like really grateful for that, that you considered us to be listening, and whatever we have delivered, we tried giving our best. Uh, so we are